A very good evening and a warm welcome to all our viewers. I'm Dr. Shatil from the Clinical Engagement team here at Doclexus. Welcome to a brand new session of this uncategorized webinar, Belly Fat Forces on Spine. Worldwide, coronary heart disease and type 2 diabetes are associated with significant morbidity and mortality. However, in persons with long-standing spinal cord injury, the risk of mortality associated with diabetes and CHD is 1.4 and twofold higher, respectively, than that of able-bodied person with diabetes and cardiovascular diseases. Various studies have shown that back pain in obese individuals is not only a result of major biomechanical changes alone, but also due to various metabolic changes. Early preventive measures amongst obese patients can help better manage spinal issues. To tell us more about this topic, we have with us today Dr. Kenneth Hansraj. Dr. Ken is a renowned orthopedic and spinal surgeon with over 21 years of experience. His areas of expertise include minimally invasive spinal surgeries and stem cell therapy. Dr. Hansraj has been board certified by the American Board of Orthopedic Surgery and holds a double fellowship in spine surgery and biomechanics. He is also the author of the famous book entitled Watch Your Back: 9 Proven Strategies to Reduce Neck and Back Pain Without Surgery. We welcome you, Dr. Ken. Our other guest today is Dr. Shiv Kumar Sarin. Dr. Shiv Kumar Sarin is an eminent gastroenterologist and the chancellor of the Institute of Liver and Biliary Science in New Delhi. He has authored over 440 publications and developed 18 major guidelines. Dr. Sarin's paper on the classification of gastric varices has been noted as a landmark paper in the New England Journal of Medicine. He has also received various prestigious awards, including the Padma Bhushan and the Shanti Swarup Bhatnagar Award. So, Dr. Ken, I would request you to proceed with your webinar. It's a pleasure to host you here today.
Thank you. It is such an honor and such a privilege to be on Doclexus, especially with Dr. Shiv Kumar Sarin, who I respect so much. Thank you, Dr. Sarin, for co-hosting and playing with us today. So my study, which I did, is called Belly Fat Forces on the Spine. And I'll explain it to you. It's highly technical in terms of it's done with finite element assessments, but I'll try to keep it on a human level so we can understand and really connect and have a good chat and really a fun time. So I'm really honored to be with Dr. Shiv Kumar Sarin. It's a big pleasure. And if you look on the bottom right, I'm so thankful for his kind words. He read my manuscript and he summarized my book, Watch Your Back, shows how to keep your spine young, supple, and pain-free. So thank you, Dr. Sarin. So this presentation is based on a study which we published called Belly Fat Forces on the Spine, Finite Element Analysis of Belly Fat Forces by Waist Circumference. And so there is a big backstory. So first off, in the United States, there are 220 million people that are obese, and there are 13.7 million people that are children that are obese, and globally it's 1.9 billion. So obesity is a big problem. And so before we go any further, I would love, please, Dr. Sarin, for you to comment on the medical effects of obesity.
Dr. Shiv, can you unmute yourself? You're on mute, sir.
Yeah. Thank you, Ken, for inviting me and for your generous words, and Doclexus for inviting me. I had read this book with great interest So whatever I've written is with my genuine perception of the utility of the book. Your talk today and by this organization is very timely. Just 2 days ago, India released in Lancet the India metabolic study of 113,000 people. And obesity was in about 35%. To be true, nearly 35 crores or 350 million people in India have central obesity. Central, you mean tummy. So instead of a belly, which is for dancing, it is a belly which is bulging. And that bulging belly, today, all the newspapers in India are carrying that story. So obesity or the fat content of the belly is associated with inflammation. The type of fat that you have in the belly is not good. It's the white fat. What you need is a different brown fat. So this fat is the source of inflammation. Inflammation means your body is in a state of constant irritation. I'll give you one simple example for you to remember for your life. Normally, the liver has less than 5% fat. If it becomes 10% or more, then it is a fatty liver. If your liver cells have fat, the insulin cannot get inside into the liver cell to make energy, and more insulin is needed, more and more is needed, and over time your pancreas gets exhausted and you get diabetes. So fat in the liver, in the belly, is the cause for diabetes. Now this fat goes out into the blood. You go and get your blood test done. Oh, mera triglyceride बढ़ा हुआ है, my cholesterol is high. You take a pill, but from where has this come? It is extra fat from the liver and the belly fat. So this fat now goes and gets into your arteries. You get blood pressure, you get heart disease, you get metabolic syndrome. So obesity, actually, especially central obesity, for which Indians are prone, somewhat genetically predisposed, is a cause. And as I told you, 1 in 3 Indians have it. So what will happen if you put more weight into your tummy? Your back has to handle it, and therefore 1 in 3 Indians can have back pain. Remember, if you have back pain and if you have belly, you must listen to this and you must understand. The 2 more parts of this question. Adipose tissue is linked to increased risk of cancer. Yes, this is absolutely true. Adipose tissue has macrophages, which take the message to the liver and to the bone marrow. In fact, every single cancer is 1.5 to 3 times more common in obese people. Be it a prostate cancer, be it a breast cancer, be it cancers of the colon, they're all more common in obese people. And recurrence of cancers, liver cancer, all other cancers is more. And they're more aggressive. So keep your belly flat to have your back pain free. So my simple message is inflammation is a result of surplus and ectopic fat in the tummy.
Thank you, Dr. Sarin. That was beautifully rendered. As a surgeon, I'm so impressed with the findings that not only are you at an increased risk for cancer, but you're an increased risk distinctly separately for aggressive or metastatic cancer. And that's scary. That's scary information.
Yeah, I do totally agree with you. Metastasis and aggressiveness of the cancers. In fact, I see very often a cancer for the liver whom we treat by microwave or by ablation. And if the patient has not lost weight, you get a recurrence. Most of the patients who have lost weight and have become underweight compared to their normal weight, the cancer does not recur. Otherwise, it's aggressive.
Thank you. So you all know the Dallas Heart Study. The Dallas Heart Group spent millions, tens of millions doing the Dallas Heart Study. And then they did a separate, interesting boutique study using an algorithm to measure belly fat. They did MRIs of, I believe, 3,500 people, 1,538 women and 1,212 men. And so I'm not going to bog you down with high science, but they did MRI scans, and at the level of the L2-3, when they take a cut, they can predict for the entire abdomen because they have an algorithm. And so we combined with the group Grundy and his group. We asked their permission, we got their data, and we offered them authorship, but they politely declined. They're really nice people. They helped us to understand their study. And so they came up with, I'll skip ahead a couple of slides. They came up with amount of fat in the belly per race and per sex. So white, blacks, and Hispanics. So right here, you can see this is the Grundy data. And you can see that it's interesting that different ethnicities carry different amounts of fat. So whites have middle amount of fat, Hispanics the least, and blacks have the most fat in men and women. And this is pre-study. So we took this data, and then we developed a biomechanical assessment. And
can I hold you for a minute, Ken?
Yes, please.
Can you go back to this very important study, and I will give just to that. Yeah, any of these. So the simple message is, now next one, the graph. For people to understand that if you have a waist of 35 or 36, that means for men, if you have 90 centimeter waist, your fat in the liver would be close to about 10% or 8%.
Wow.
So the standard for waist should be, for women, it should be 80 centimeters, and for men, 90 centimeters. So don't fit jeans onto you. Fit into the jeans, and your back will be good. So remember, this is a very beautiful study which has been picked up. Don't have a waist size of 40. Imagine what's going to happen to your abdominal fat, 20%. So anybody who is using a trouser with 40-inch waist, please revise. Don't use that. Tell your tailor, I'm going to get into 35-inch weight. All right.
I think it's the first time, Dr. Sarin, I've heard it, and I think it's so very important. The connection you made to waist circumference and levels of fat in the liver. So you say 35 waist, I know inches, 35 inches of waist is 10% fat, and you previously stated that's way too much.
Yeah, it's too much. So ideally, you should have a waist 90 or less for men in centimeters, and women 80 centimeters or less.
That's an interesting connection. Thank you. So we've done finite studies, and so we loaded our model, which is we computerized the human and computerized the spine, and we tested it and validated it, and we placed the abdominal fat into position, right? So as we stated, the heavier the abdominal fat, the larger the waist circumference. The larger waist circumference will be will lead to momentum, and hence the force on the spine. That's pretty simple. The bigger your waist, the more belly fat you have, and the more momentum and the more leverage force on the spine. Now, finite element is a really excellent, very highly sub-millimeter, less than 1 millimeter precision. So typically they'll use this strategy to design space rockets. And so predicting forces is what finite does. And so we came up with numbers, which I'll explain to you. And now these are results, Dr. Sarin. I think you'll find these interesting. The results in forces are the same as the results in belly fat mass in poundages, right? Now, keep in mind that this study only reflects belly fat, not like the organs, not the organs in the belly. This is just the influence of belly fat by waist circumference. And again, it's interesting. You can see populations that have tremendously more belly fat at the same waist circumference than other populations. I think that's very interesting. Would you like to comment on that?
Yeah, this is news to me. This is a very important study. I have never thought it that way. I thought everyone with same amount of belly fat will behave similarly. But of course, the back stress and the force on the back will depend upon how you inherited your back, maybe in generations to come. And I thought black people would have more stronger backs, but here I find the black women maybe most predisposed, maybe due to multiple pregnancies in addition. But yes, a black woman with 40-inch waist has a very huge spinal force, maybe almost twice that of a Hispanic man. Very interesting, very educated.
So this study, I promised you not to get too technical, but there are ways to display the data. And so learn to appreciate the displacement on the spine by the belly fat. And this is mathematical modeling now illustrated. And so look at the white woman at 70-inch waist and a black woman. See the difference? You see that extra displacement from the extra force. And Hispanic women are in between. And then same with white men, a black man. You see the stresses on the spine that displaces the spine. And now so this is the data, but you'll really get a beautiful understanding of it. This is just the data, right? So we got data. Here we go. So this is belly fat forces on the spine in men. So at 25-inch waist circumference, a person sees, a white gentleman sees 1 pound of force, and a black gentleman sees 1 pound of force. And by population base, the Hispanics see 7. But as the waist circumference becomes bigger, let's take 50 inches waist circumference. In white men is 65 pounds, and black men is 75 pounds, and in Hispanic men 60 pounds. So what we did was, the Indian population is saying, hey, where do I stand? So we averaged all the numbers, right? And so typically a good rule of thumb is if you have 25 inches waist circumference, you're seeing 3 pounds of force, and at 40 inches, 40 pounds of force. 50 inches, 65 pounds of force. Let's say a bowling ball is 12 pounds. It's 5 bowling balls hanging off your belly. And 70 inches, 120 pounds of force. Now, to make the data understandable, so we would say, hey, 25 inches with 2.8 pounds of force, it's like carrying a wok on your belly. 30 inches like a cat, and 34 inches like a garden statue, and 36 inches, 4 gallons of water, and 40 inches, 4 gallons of paint, and 45 inches, an average male bulldog, and 50 inches, a lawnmower, and 55 inches, a truck wheel. So these forces are tremendous. And you can see most of the forces land at T12 and L1. It lands in a specific zone. Would you like to comment, Dr. Sarin?
Now, this is scary and a very simple way of educating people how much it means additional 2, 4, 6 inches of waist and the belly fat. It is just to emphasize that even at 25 inches, the fat can have different connotations. So I would say, of course, when the waist and the fat is more, you understand. But I'll give a different perspectives for Indians. There are two people, let's say both have a BMI of 23. And there is a white person and there is a Indian person. A white person, and as you saw that, the force on the spine was only 1 pound, because the belly fat in a white person of the same BMI of 23 is just about 8 to 10% of fat in the belly. But the same waistline, the same BMI, an Indian would have 3 pounds of force. And the reason is Indians would have 18 to 20% of the belly with the subcutaneous white fat. So in Indians on the same weight, let's say you have a white with same BMI of 23, Indian with BMI of 23, the intra-abdominal white fat is generally 3 times more. So I totally see this converted into the back force of 3 pounds, and I think it's very reliable and very educative.
And so I'll press you, Dr. Sarin. So sometimes when I present to my friends in India, I love to make them smile and I say, hey, more dal, less roti. But what in the Indian menu would you recommend to build more brown fat, and what would you recommend to diminish for white fat?
Yes, partly it could be the genetics. The South Indians have generally more of white fat. They are the Dravidians, the originals. But to keep more of brown fat, you do require abdominal exercises and mobilizing it, and avoid. It's not the fat what you eat, it is the carbs what make you fat, especially the fructose. And Indians have a sweet tooth, and they sometimes have corn and all that, the fruit juices and others which are in cans. So I would strongly recommend to avoid that, reduce it, and maybe a plant-based diet will be much better. But remember, 20% of Indians have fatty liver and they are lean. Of 100 people, 20 are lean but still have fatty liver, 80 are overweight or diabetic. It is for those lean people we are worried. You say, oh, this guy was just 30-year-old. He was not overweight, but he got a myocardial infarction. He got this. And the reason is they're genetically predisposed, and also they have more fat in the abdomen. So spinal force will also be more in them, and they may suffer more from back problems.
Thank you, Dr. Sarin. And so we'll move on to female numbers. Now, women in general have more belly fat. They just do. And so they have more belly fat forces. And so remember, again, I repeat to you, we're just measuring belly fat, not the organs. And so, at 25 inches, a white woman would be 5 pounds of force, and a black woman here, and this is the actual data, has 1 pound of force, and a Hispanic woman has 10 pounds of force. But it's at the bigger waist circumference that you see the differences that stand out. You saw the curves. And so at 40 inches, a white woman would have 55 pounds of force, a black woman, 60 pounds of force, and a Hispanic woman, 60 pounds of force. Now, the average woman, right? So we want an average woman. So at 25 inches, 5 pounds of force, 60 pounds of force, 50 inches, 95 pounds of force. And we all know women that have 70 inches or 65 or 60-inch waist circumference, and it's 170 pounds of force. So that's like carrying a punching bag around, while the 50 inches is carrying a baby horse, and the 45 inches a baby rhino, and 40 inches a husky dog. So from metabolically, which Dr. Sarin is covering so beautifully, it's dangerous. And as he says, the liver gets into trouble with a waist circumference of 35 inches. And so then you're 10% liver fat content, which is scary in itself. My study speaks about the forces that the spine sees. So please comment, Dr. Sarin.
I think this is a bit worrisome, especially women post-delivery. They have gestational diabetes. Their fat is a bad fat in their tummy. Also, I would like to take this opportunity to share that the origin or reformation of the bone is by, osteoblasts. And osteoblasts are the cells which make the bone. Dr. Ken will correct it more. And their parent and the parent of adipocyte, that is the fat cell, is same. Bone marrow can either have energy to make more osteoblasts or more adipocytes and the pre-adipocytes. Now, if there is extra surplus fat, you will make more adipocytes to collect the fat, and your bones will become weak, and they may in fact become osteoporotic. They may become prone to fractures. So there are two parts. One, you are having a baby horse or a baby rhino carrying in your tummy with extra fat, but that bag itself is weak. So you may have more spinal injuries or you're predisposed. So remember this. And I think it is much better for us to understand that bone is a very active organ. It is just not a block which you create. It's one of the most dynamic endocrine organ of the body. So we have to maintain its utility and its efficacy.
Thank you, Dr. Sarin. So I wrote a book, Watch Your Back, and I'm really proud to say it's available all through India right now. And I would endorse it to say it took 5 years to write with an amazing team. And Dr. Sarin wrote, it's really simple. It's really to help people. These are strategies to help people with back pain and back health. And especially, I think if you want to live to be 100, you must mind my 9 strategies. And here's, we're covering the belly fat study out of Watch Your Back. And so these are the diagrams we used in Watch Your Back, and just to show you this, it's a different set of illustrations. And I certainly hope the publisher is okay with this. And so these are some of the examples of the approximate equivalent. 50 inches is, and we all know lots of people, men with 50 inches, and that's 58 hardcover books. And then women, it's 50 inches is a baby crib, right? So we have made the point that belly fat has consequences which stresses to the back. And Dr. Sarin made the point that, well, you have a choice of making fat cells or making bone pieces with osteoblast performance. And so if you have more fat cells, then you're weaker anyway in the bone and you're more prone to injury. And so we'll continue now. So I think you have this, right? You have this, the bigger the waist, the bigger the problem. Do you want to comment, Dr. Sarin?
Yeah, I would certainly say, I see, like I was in clinic, and out of 170 odd patients, I would at least have 20 obese or morbidly obese patients. And it's painful to see many of them have come, although they have liver disease, but of similar similar age, but leaner people, these people came on wheelchairs. Why on wheelchair? They cannot stand well, they cannot hold their bottoms or their tummy properly. So they, if we send them to get their a DEXA scan for bone density, almost all will have osteoporosis. So if you have a tummy which is heavy in weight and you have a big waist, I think you are harming yourself and you need to be extra careful. If you know these numbers, that so much tummy, I never knew this, that there is so much pressure on the spine. I would be more careful because not only my looks, but my back both become bad.
So a little bit of humor, Dr. Sarin. I say to my patients playfully, I say, hey, the GI doctor is like, Dr. Sarin wants you to be healthy for your belly health and lightweight and fit and low fat. And the pulmonologist wants you to be healthy for your lungs and your lung health. And the heart specialist wants a healthy heart. I want you to be hot, because if you're hot, then you have a great heart and a lung and a GI tract. That's as I will comment on that without getting into trouble. Hopefully that's a bit humorous.
That's true. I think it's a good message, worthy. And it's very good that you can dance well. We all used to go and see the Egyptian belly dancers, but now our bellies are different. Neither they can make you dance. In fact, you can lose your back if you dance with such a tummy. So if you want to dance, if you want to live life, enjoy life, have a belly which is thin, keep your belly, your liver, your tummy well, and of course, safeguard your back.
Okay, so this is a summary of everything we've said. You got this message, so we'll move along. And we have significance in these data, right? This is a very nice study. I was very happy to do it. Now, I wanted to set you up, Dr. Sarin, if you want to talk about subcutaneous fat and visceral fat.
Yes, the visceral fat is the one which is somewhat genetically bad, and it is white fat which you have inside. And it is the fat which is generally used for your storage purposes. But this visceral fat, as I told you, if it becomes ectopic means it is in places where it should not be. So it should be outside rather than inside the viscera. So if it is in the liver, it is bad. If it is in pancreas, it is bad. If it is in your arteries, if it is in your blood vessels. So this visceral fat becomes ectopic if it is misplaced. And it also is not easy to get rid of. What you do is when you get a liposuction and others done, you get some subcutaneous fat out. Now you feel very happy, oh, my waistline has come down. But the bad fat does not come down with liposuction and similar such devices which people are selling. What you need to do genuinely is to reduce your calorie intake. Maybe every day you should plan 300 calories less and burn 300 calories more. So over a period of a week, you might lose a kg or kg and a half. Second, I strongly feel, and Dr. Ken can correct me, that the old Indian exercises for yoga, that is a halasan, where you can bring your legs back. This is before you have backache, to prevent. So if you can raise your legs well up and your abdominals are strong, your back will be strong. So keep your upper, mid, and lower abs strong. Like Shah Rukh Khan, you have 6-pack abdominals, so you'll be good. And that will keep your back straight. Second, if you do halasan, it might remove the fat from your liver and other abdominal organ. So for me, subcute fat is less dangerous than the deep visceral and ectopic fat.
I love that. I think we should combine and do a granular list of a presentation on the granular list of conversion of brown fat to white fat and all the things you can do. I think you'll be very, very important. And that's the collaboration of my forces and your medical contribution to what's happening to the body is 100x, not 2x. It's amazing. So thank you. And now just a little bit more. So you talked about the visceral fat and the subcutaneous fat. And I just want to point out that, fat is dangerous. Fat is not your friend. And so certainly regular fitness exercise with moderate intensity and proper nutrition. But in our book, we had one concept, so we have 25 stories in Watch Your Back. And so I want to describe with you the cookie subtraction scheme. So I saw a patient in the office, a nice lady, she's 5'2" and 250 pounds. And so I said she had back pain. So I got an MRI and the MRI is negative and the MRI is normal. So I said, well, we have to talk about what you're eating. And so the tears come flying down, and she's a nice lady. She goes, I'm so sensitive about my weight. She says, I don't eat breakfast, and for lunch, I'll eat a very healthy lunch. And for dinner, I have a salad and salmon or a salad and chicken every day. And I don't know how I'm gaining this weight. So I pressed her, even though the tears are flying and you don't want to press her, but I pressed her. And so she said, before I go to sleep, I'm so hungry. I eat 6 little cookies, she says. So I did the mathematics, right? And we published it in Watch Your Back. So every cookie, which is 125 calories, which is the same for a bear, which is 125 calories. And I can't tell you the amount of guys that I've helped by understanding that this concept of cookie or bear subtraction. 125 calories a day for 365 days a year. It's 40,000 calories divided by 3,500 calories a pound is 13 pounds of weight gain. Or if you go in the path of encouragement, weight loss. So if you say, what? If I lose a cookie a day, I'm losing 13 pounds a year. And so people quickly find a way to start losing 500 calories a day. As Dr. Sarin says, eat 300 less, exercise 300 more, but they can quickly lose 500 calories a day, which is a pound a week and 50 pounds a year. And I've helped so many patients just open their eyes and open their hearts and lose 100 pounds or 80 pounds or 125 pounds just by understanding the mathematics. So, Dr. Sarin, you tell us some stories now about weight loss and weight strategies.
This is beautiful, the cookie subtraction scheme. It is so simple to understand. I just want to add, if you take, let's say, the same cookie at 6 in the evening, and you take the same cookie at 9 p.m. in the evening, late evening, are extracted from the same amount of carbohydrate or fat. This is the effect of the bacteria. The 2017 Nobel Prize went to the clock gene. Clock genes are your diurnal rhythm, the way you sleep, the way you get up. So what you eat is actually you do not eat. What you eat is eaten by the bacteria. They are in your gut. And if you keep them alive, active, kicking at 9 p.m. in the night, you will not be able to sleep before 11. Your bacteria do not cool down. So its first thing is eat early. 2, do not eat cookies. 3, remember that whatever you are doing stealthily by eating cookies at 9 p.m. will not make you sleep well. And last of all, I think cookies are not good. They are good for your tongue, but really, really bad. And therefore, my suggestion would be an Indian or even Jews who eat early and maybe have a long hour of not eating. But what you have shown, if everyone practices, half of my job is done. They will come down on their beer and they'll come down on their cookies, which they eat in the night. Don't do that in the night. Have a good dinner, early dinner, but no cookies.
I think your contribution was super fantastic, Dr. Sarin. I think, do you have anything else to add? I think we're approaching taking questions.
No, I had never met Ken. I just had interactions on WhatsApp. So I'm seeing him for the first time and talking to him for the first time. Just to tell everyone that it is because of his outstanding book and the way it is written that I got immensely attracted, and I am happy that he invited me to join this. But we will do more granular work, Ken, in future.
Dr. Shatil, you want to take it?
Sure, Dr. Ken. It was absolutely wonderful presentation. So great takeaways for the audience here. So we have a few questions from the audience. I would request the audience to post more questions and we can take it up. So my first question to you, Dr. Ken, it's from Dr. Chiranjeeva Khandelwal. So he wants to know, will spinal exercise negate the forces that you are mentioning here?
Oh, absolutely. Absolutely. So Dr. Sarin spoke about the different genetics and the different qualities of fats that we inherently have. And so I'm more of a mathematical guy. And so certainly we've calculated the fat force, but we know and we encourage, for example, the worst case scenarios, the guys that get the most forces to the spine are like your FedEx lifters who will lift 1.5 pounds a year. And so I encourage them to, every time they lift, to engage their core muscles and their quadriceps and hamstrings. And what happens is when they're building and using these muscles, they become bigger. And so they lift with greater ease. And that's how an older lifter could lift even better and more with less forces to the spine. So the answer is definitely build your muscles.
Thank you for that answer. Moving on to the next question. So my next question to you is, an obese individual is who usually has less activity. Kindly explain how this can further deteriorate with a spinal issue needing a partial or complete bed rest.
So the bed rest is typically days. No one recommends bed rest for weeks anymore. So it's not a real factor. If you lie down for a few days in a year, I think you're fine. Maybe Dr. Sarin has a comment. Do you?
Well, I'm only worried about the deep vein thrombosis in such a person and also a rapid decay of the muscles. So even if the person is bedridden, I would encourage him to do some pumping for his legs and also some exercise for his hands. Back can be given rest, but limbs must be mobilized.
I think that's a much safer answer. Thank you for that. Go ahead.
Thank you. So moving on to the next question. So my next question to you is, visceral fat is also sometimes associated with low mineral density, like already Dr. Sarin spoke about it. So we all know that there are chances of fracture in such cases, in cases of fall. So we wish to know how detrimental it could be. You being a surgeon, you must have faced cases.
So I think Dr. Sarin will have a deeper answer to this, but belly fat gain and loss takes so long. And so it's not a direct factor, right? So I think, if you gain weight and lose weight, how does it affect your bones? It's definitely, if you're gaining weight, and it's probably that you're not moving and you're eating poorly and your bones are not as, doesn't have as much calcium and vitamin D. So it's probably weaker, but I'm not aware of any study that says that. That's just my opinion. And Dr. Sarin, how do you feel?
Well, I think the early age obesity, now we know that even the younger children, they would have osteopenia by the age of 25 or 30. So your bones grow till the age of 30, and after that, all of us have decay in the bones. To maintain the bone, you need to have a very strong exercise and discipline regimen. So in DEXA, you have the two ways of comparing. The DEXA scan gives you bone mineral density. So you compare, if there is a 60-year-old man, he will be compared with a 30-year-old to say what is the difference. So that is your T. And then you compare it 60 with a 60-year-old healthy one, that's your Z. So you find out how much is the difference from a 30-year-old. So if I see a person who is 60 and has a normal DEXA, it means his bones are as young as of a 30-year-old man. And that is a beauty. And then I can say, oh, look, you're like 30, you can run. You have no problems in that. But if you have a 30-year who has bones like of a comparing to a 60-year, you are doomed. You have to do something more for this man.
So I would take difference with you, Dr. Sarin.
Yeah.
I would not say doomed. I would encourage them. I would say, well, now you need a year of work, or
Yes.
you need 2 years or 5 years of work.
Yes.
Because I believe our duty is always to encourage.
I totally agree. I would withdraw. I would not say doom. I said you are not in a good bone health. Improve your bone health and take some advice from Ken. Okay.
Thank you for that wonderful answer. I thought you would be suggesting surgery, but instead you're suggesting work on your bones and take a year or so. That's a great advice any patient could have. So my next question to you is, obesity, which is currently an epidemic, how could the policymakers or doctors who have some influence help in controlling this pandemic, given that it increases the burden on healthcare?
Dr. Sarin, you go, please.
Well, the best way is to have a school. Let's say it's a 4-hour school, 2 hour of teaching, 2 hour of playing, or doing something else. What we have done is reduced, if like there are exams, the first thing is, preparatory leaves, no more PT classes, no more doing the games. You remove all the vital things. I think chemistry, maths, or bio are more important. I think they are okay, but more important is your health and understanding about that. So policymakers first should focus on the kids. 2, labeling of foods. They must know what is content and boldly written, not small prints. 3rd, the policymakers must put some tax on sugar, possibly on, and if they can make green kitchens across the world, I think it will be very healthy. But tomorrow, I think the lobbies are so strong, whether it is a Big Mac or whatever, not naming, but they're big lobbies. Yeah.
So my message is the same as Dr. Sarin's, but I think your question is, how do we create public awareness? And I think this presentation is probably premium for that. It would be nice for you to get this message to send it from DocPlexus to your leaders, your political leaders, and make them aware. And from my contribution, bringing mathematics, so to speak, in the equation of waist size and waist pressures, I think it's very helpful in opening the eyes. And then you have Dr. Sarin who's saying, hey, even the small waist, like 35 inches, leads to liver damage so severe that you're going to get diabetes. And so this discussion is of most importance in helping Indian people to understand where to go. And then if they, I believe if they can feel it, then they can do it. And it may take a year or 2 or 3 or 4 or 5, but they can turn the ship around.
Thank you, Dr. Ken. It was absolute pleasure listening to you. We have come to the end of this webinar now. And thank you so much, Dr. Sarin, as well, for your wonderful words. So this brings us to the end of this session. Thank you so much, Dr. Ken and Dr. Sarin, for your time and effort in putting together this interesting session. To our dear viewers, thank you so much for attending this session. Do share any more questions if you have. Until we see you again, take care and happy doc plexing. Thank you.
Thank you.
Thanks.